Good afternoon. Chronic disease. Does what we eat make a difference? Firstly, my disclosures. I'm the founder and chair of Sugar by Half, a not-for-profit organisation. We run educational programs for school children and public campaigns. I'm an author. I have a book, A Fat Lot of Good, that spent a number of weeks on the best-selling list in Australia. You don't have to sell many books to make the best-selling list in Australia. And I've got another book coming out next month, The Diabetes Plan. And I'm the founder and chair of Defeat Diabetes, an app-based program to tackle type 2 diabetes. Well, I'm from Australia, and I just want to thank Jeffry Gerber for inviting me over to speak at his conference. And I'm from the lovely city of Melbourne, which for a number of years was known as the world's most livable city. For the last 2 years, it's been known as the world's most lockdown city. So we won't go down that little rabbit hole for the moment. What am I doing here? As you mentioned, my career is in sports medicine. So why am I speaking at a nutrition conference? Well, it all goes back to 2012. I've worked with a lot of sporting teams over the years, individuals and sporting teams, professional sporting teams, Olympic teams, World Cup soccer. And in 2012, I was in Liverpool, England, single-handedly winning trophies for the Liverpool Football Club. And if you'd asked me then, how are you, Doc? Are you well? I'd have said, yeah. I just turned 60. I had been on a low-fat diet all my life. I exercised regularly. My blood sugars were fine. Yeah, thanks for asking, but I'm good. The reality is, I probably wasn't quite as good as I thought I was. For a start, I had a family history of type 2 diabetes. My father had developed diabetes at exactly that age, and I was pretty aware I didn't want to go down that track. I was overweight, borderline obese. Like many middle-aged men, and I considered 60 middle-aged. I used to think it was old, but now I think it's middle-aged. I'd probably put on £1 pound a year for 30 years. Slowly getting a little bit thicker around the middle. And my kids are starting to sort of poke me in the gut and say, come on, Dad, it's time you did something. And I'd shrug my shoulders and say, well, I'm on a low-fat diet, I exercise, I'm doing everything right. Despite that, I was markedly overweight, probably 30 pounds overweight. I had high insulin levels, I had high triglyceride levels, and I'd had a fatty liver on liver function tests for about 10 years. Now, I'm a sports doctor. I didn't really understand what a fatty liver was. I figured I was on a low-fat diet. I'd be fine. So I ignored it, as most doctors do. So, as you can see, I was either 6 months pregnant or significantly overweight. But then again, a couple of my football colleagues here were pretty similar. Maybe it's something about working in football. But anyway, so around about that time, I heard from my old friend Tim Noakes, who many of you would be aware of. Tim and I are old buddies, and he's a really smart guy. And he previously challenged a number of things in sports science that everyone thought he was crazy, and he turned out to be right. But this time, he really overdid it. I noticed he came out and said, no, we've had it wrong all this time. It's not fat that's the problem, it's carbohydrates. And I thought, oh, come on, Tim, really? You've totally lost the plot this time. We couldn't have all been wrong for 30 or 40 years. But because it was Tim Noakes, I thought, I need to look into this. So I bought a book. It's an unusual thing for a doctor to do, but I bought Gary Taubes' book, Good Calories, Bad Calories. And this book just blew me away. Not only because it talked about the relative merits of fats and carbs, but talked about the politics of how the low-fat movement had won out of the low-sugar movement way back in the 60s, for which I always assumed was due to good science and evidence, but turns out to be due, like most things, to money. And I found it really disturbing. I remember sitting down on the edge of my bed at night, looking out over the beautiful Mersey River, thinking, no, this could not be right. We could not have the whole of Western society on the wrong diet for 30 or 40 years. And yet, everything I was reading suggested that. So then I did a deep dive, and I read every article, every book I could possibly get my hands on, and was influenced by all these wonderful people, by Jeff Volek and Steve Finney, Tim Noakes I've already mentioned, and of course the wonderful Nina Tarshos. Now, don't tell my family, but that's actually my favourite photo in the whole world. It's not often you get to stand with 4 of your heroes in one photo. But I read everything I could, and I was more and more convinced that we'd been wrong. But I thought, no, I'm a scientist. I need to do some science, do some research. But I also knew research with an n equals 1 is a waste of time, except when the 1 is you. So I decided it was time for an n equals 1 experiment. So I decided I'd go on a 3 months low-carb, healthy fat diet. So day 1, got all my blood tests done, jumped on the scales, and I went low-carb, healthy fat. And I don't need to tell you people what I did. I stopped eating all this horrible stuff and started eating probably the way that my grandparents had eaten. All the good stuff that we've been told not to eat. You know, eggs, all that cholesterol, my God. Butter, oh, saturated fat, all that. So what happened? In 13 weeks, I lost 28 pounds, 13 kilograms. I was half the man I used to be. I enjoyed every meal I had. I was never hungry. I couldn't believe it. I sort of felt a bit guilty. I thought, this losing weight's supposed to be really hard. It just kept falling off. Every week I get on the scale. I can't believe it. I lost another couple of pounds. So at the end of that 3 months, I was pretty happy. I won't bore you with all my blood details, but just have a look at my liver function results. You can see there for the previous 8 years, my liver function had been quite elevated, consistent with fatty liver. And in 3 months, maybe even less, I only did the blood test at 3 months, it had gone completely back to normal. And it's stayed normal every year since then. Amazing. That's not supposed to happen. Where's that in the medical textbook? And as I said, I didn't really understand about fatty liver. I felt a bit better when I discovered 1 in 3 Australians also had fatty liver, but they probably didn't understand it either. And there was this wonderful saying from Roy Taylor from Newcastle. Before the diagnosis of type 2 diabetes, there was a long silent scream from the liver. And clearly, I was pre-diabetic. And I have no doubt that if I hadn't changed my diet, I'd have followed my father's footsteps and been a fully blown type 2 diabetic pretty soon after that. So at the end of the 3 months, reduced appetite, lost 28 pounds, increased energy, improved sleep, decreased triglyceride, insulin level normalised, fatty liver resolved. Pretty good 3 months' work, eh? Imagine if you had a pill that did that. There was one drawback though. I needed a new wardrobe, but anyway, small price to pay. So I then became a passionate advocate for this. My second light bulb moment. I left Liverpool, I was sick of working with crazy football managers, and took up the job with the Australian cricket team. Now, cricket is our national sport in Australia. It's one sport that everyone loves. It was a sport I played as a kid, so this is my dream job. And cricket's a weird, don't get me to explain. Cricket's a weird sport. We have these test matches that go for 5 days, and sometimes they end in a draw. Anyway, pretty crazy sport. But we go on these long tours. So we go for 2 months, 3 months tours to other countries. So the following year, I was in India with the Australian cricket team on a 2-month tour of India. And one of our players came up to me and said, Doc, I'd like to lose a bit of weight. He was he was 4 or 5 pounds, 4 or 6 pounds maybe overweight. And it's amazing how many high-level athletes who are full-time professional athletes are actually overweight. Anyway, that's another story. He came and said, I want to lose some weight. And I know you were successful in losing weight. I'd like to try. I said, sure. So India, not the easiest place to go low carb. No rice, a naan, all those nice things. But he was very good. He was very committed, and it's a good thing about working with professional athletes. They're very disciplined. But at the same time, he told me another story about his knee pain. And he'd had knee pain for a number of years. In fact, to the point where a few years earlier, he'd had to stop playing completely. He'd been to see everyone in town. He was in Sydney. If he'd been in Melbourne, I would have sorted him out, of course, but he was in Sydney, and he'd been to see all the specialists there. He'd had MRIs, he'd had arthroscopies. No one could work out what was going on. And eventually, he saw a rheumatologist who diagnosed him with seronegative arthritis. Put him on some serious drugs, methotrexate and prednisolone to start with, probably got him 50% better, at least got him back training, and then put him on one of the tumour necrosis factor inhibitors, Enbrel, and he was back playing full time. And he told me then that he was injecting himself with Enbrel every fortnight. And about day 10 of the fortnight, his knee would start to ache, and he knew it was time to have his injection. So anyway, he started on the diet, and he was very good with it. And 3 weeks later, he came up to me and said, "Doc, I forgot to take my injection last week." I said, "What do you mean?" He said, "Well, I haven't had any knee pain, so I sort of forgot. What should I do? Should I take my injection now?" And of course, I pretended it was exactly what I predicted, and I knew that would happen. And I said, no, I want to just wait and see what happens. Anyway, that was 10 years ago. Since then, no drugs, no pain. He increased his training. At the time, he was in our squad, but he wasn't in the top 11 players. He soon got into that, and a year later, he was in the top 10 players in the world. And interestingly, 10 years later, he's actually back in India now. The team is doing another tour of India now. And his last 2 years have been his best years ever. And he was the #1 test batsman in the world last year. So if he hadn't changed, all due to his diet. I mean, that's not supposed to happen. And again, that really blew me away. It opened my mind to a whole range of different things. Okay, so we're talking about chronic disease. 6 out of 10 Americans have chronic disease. Wow. But wait, maybe that's an underestimation. We've heard only 12% of Americans a few years ago were metabolically unhealthy. And last year it came down to 7%. A few more years and the only metabolically healthy people will be you. So obviously we're not winning. What can we do to reduce this? Is there a role for diet? Is there a role for a low-carb, ketogenic diet in the management of chronic disease? There's evidence, limited though it may be. As we know, it's very difficult to do nutrition studies, and it's even more difficult to get funding for them. But there is evidence for a low-carb, ketogenic diet in all these different conditions. And over the next 3 hours, I'm going to take you through all the evidence for those conditions. Sorry, I got a dirty look from Jeff then. But what I want to do is just give you a few examples, and maybe not the most common ones. Let's just talk about these bottom 4 areas. Just very briefly, I'm just going to race you through a little bit of the evidence to show you what's out there. It's limited, but it's encouraging. Epilepsy. Now, we've known for over 100 years that the ketogenic diet is an effective diet in paediatric epilepsy. And you're all familiar, I'm sure, with the Charlie story. Little Charlie Abrahams at the age of 11 months had intractable epilepsy, tried everything, went on a ketogenic diet, stopped his seizures, stopped the diet after 5 years, had no more seizures. His father was a Hollywood producer and produced the Meryl Streep film, and the wonderful Charlie Foundation was established. And now ketogenic diet is standard treatment for drug-resistant paediatric epilepsy. But what about adults? Is there any evidence for that? Well, there is positive evidence for the use of a ketogenic diet in athletes with intractable epilepsy, particularly drug-resistant epilepsy. Eric Kossoff, who's known to many of you, has done some wonderful work in this area, and he's identified a number of the rarer types of epilepsy that have been shown to respond well to a ketogenic diet. According to a Cochrane review, which is the ultimate sort of review in looking at evidence, seizures, there's about 30% of epileptic seizures that cannot be controlled by drugs, and of those 30%, a third to a half of those can reduce their seizure frequency by 50% with a ketogenic diet. Doesn't sound much, but if you're one of those people, it's very important. You can see here that there's all the observational studies show a positive result for a ketogenic diet. The biggest study, 160 patients, adults and adolescents with drug-resistant epilepsy, at 6 months, greater than 50% seizure reduction was seen in 26% of those on the ketogenic diet, or the modified Atkins as they call it, and 2% of the control group. So some pretty convincing evidence that it should be used in drug-resistant epilepsy and maybe even in first-line treatment for epilepsy. What about the neurodegenerative diseases? Well, we're all familiar with the links between Alzheimer's and metabolic disease, in particular diabetes. It's sometimes called type 3 diabetes, isn't it? And we also know that Alzheimer's drugs have been a monumental failure. Billions and billions and billions of dollars have been sunk into trying to develop Alzheimer's drugs, and 100% failure. What's the cause of Alzheimer's? Well, maybe it's diet. You know, the funny thing is, 100 years we've known that a ketogenic diet works for epilepsy. Wouldn't you have thought in that 100 years, with all the great minds of medicine, someone might have said, hang on a minute, if a ketogenic diet works for a disease like epilepsy, maybe it works for some other neurological diseases. No, couldn't possibly. No one in 100 years thought about that. So there has been a little bit of research done in ketogenic diet and Alzheimer's. This is a systematic review, but the systematic review is only as good as the trials it can review. And there have not been many. This is one by Matt Taylor, looked at 3-month medium-chain triglyceride supplemented ketogenic diet in those with Alzheimer's. They used the various Alzheimer's scores, and it certainly had only 10 completed, so very small studies, like many of these studies, very small, significant improvement in that. The best study is by my New Zealand colleague, Matt Phillips. Now, Australia and New Zealand have a sort of funny sort of relationship. They're like your annoying little brother, really. You know, they're a bit of a pest, really. They're always sort of hanging around, trying to sort of, you know, be as good as you, but except in rugby they're not. But and if you've got any challenge in New Zealand, you have to come to Australia, and then we adopt you and pretend that you're Australian. So, you know, like Keith Urban and Russell Crowe, and I tried to find any others, but I couldn't. But, you know, they become Australian. But there is one, you know, and we usually just refer to them as bloody Kiwis, but there is one bloody Kiwi who's still in New Zealand who's doing a great job. And this is Matt, who's a neurologist at a hospital in New Zealand. And he looked at 26 patients and randomly divided them into a ketogenic diet or a usual diet with a crossover period. So they did 12 weeks on each with a 10-week washout in the middle, and looked at various Alzheimer's assessment methods. And I won't go through all the details, but you can see the ketogenic diet's in red and the normal diet is in blue. You can see there are significant improvements in a number of parameters. And what he did find was that compared to the usual diet, there were improvements, marked improvements in daily function and quality of life. Two pretty important things for people with Alzheimer's disease. Now, if that had been a drug with those results, it probably would have been on the front page of every newspaper. Matt Phillips would make $1 billion, and in 10 years' time he'd get a Nobel Prize. Anyone ever heard of Matt Phillips? Anyone ever heard of this study? Buried. Amazing, isn't it? What about Parkinson's disease? Well, there's been associations with sugar and insulin resistance with Parkinson's for a long time. But again, minimal research been done. Why? 2005, 5 of 7 volunteers. Small studies, but encouraging. Why? It took another 15 years until there was another study. Again, showed good results. And the last study by Matt Phillips, same guy. 2 Nobel Prizes. Pilot randomised control study, 8-week, 44 commenced the diets, 38 completed, so pretty good completion rate. You sort of assume that people with Alzheimer's are not going to be very cooperative, but you know, in this case they certainly were. And again, looking at the non-motor daily living experiences, again, probably the most important component of Alzheimer's, dramatically improved results. 41% improvement in baseline scores compared to 11% in the other group. And observe urinary problems, pain, other sensations, fatigue, daytime sleepiness, cognitive impairment. Very impressive results. Again, lost. Multiple sclerosis, horrible disease. I'm just going to quickly go through, but there's lots of little studies, little pilot studies. This one showing improvement in overall quality of life. Again, improves fatigue and depression. Improves body composition, depression, neurological disability, fatigue, quality of life, adipose-related inflammation. Improves fatigue, impact of musculoskeletal, multiple sclerosis symptoms, disability. All pilot studies. And lastly, one that improves serum neurofilament light chain, which is a good indicator of progress. Now, you're all familiar, I'm sure, with Dr. Terry Wiles, who basically solved her multiple sclerosis problem by changing her diet. She's got a wonderful TED Talk and this wonderful book, The Wiles Protocol. And Terry's been involved in a number of research projects that, again, have shown encouraging results. But again, small studies. The world is crying out for large studies like in these areas. But who's going to fund them? There's two ways of getting funding, isn't there? One's drug companies. Well, they're not going to fund something like this. And the other is government agencies. Well, it's against the dietary guidelines. Whoa, no, we can't fund that. And finally, what about mental illness? Obviously, we heard a wonderful talk from Chris Palmer yesterday. But there are a number of areas of mental illness that have been studied in relation to low-carb diet. And there's this wonderful book, The Inflamed Mind, by Edward Bullmore, a professor of psychiatry in London, that I read a few years ago. And I got really excited. I thought, this is really interesting, until I got to the last chapter when he talked about things that were going to solve the inflammation that was causing the depression. Drugs, drugs, and drugs. No mention of diet, no mention of exercise. And I thought, such a letdown after such a good book. I'll have a talk to him one day and sort him out. My third light bulb moment. I was in the coffee queue at university. I'm a professor of sports medicine at La Trobe University. I was in the coffee queue, and we drink real coffee in Australia, in Melbourne, not the dishwater that you guys serve up. But I was in the coffee queue, and this lady came up to me and said, Professor Brukner, I enjoyed your lecture the other day. I said, that's very kind of you. Or she said, but that's not what I want to talk to you about. I thought, oh, God, I thought, what have I done? What did I say in the lecture? I was racking my brains, who did I offend? She said, my husband and I are massive cricket fans. Because of you, we changed our diet. And my husband's been bipolar all his life. And he's now off all his medication. You've changed our lives. I just want to say thank you. Whoa. I'm not often speechless in my life, but I was then. No one ever used to say that about fixing their ankle or their hamstring or something like that. But anyway, that blew me away. Because again, it opened, and patients teach you everything, don't they? Opened my mind to the link with mental illness. And as Brett Sherb quoted this study yesterday, it's only online reports. But again, it's quite convincing about the effect of diet on bipolar disease. But again, what's in the literature? Case studies, small reports. Again, we're crying out for proper research. And this shows a very good explanation of why a ketogenic diet may be very useful in something like bipolar disease. And again, this study was referred to yesterday by a French Dr. Albert Danin with some very well-known co-authors known to this audience, and it's lovely to see Eric here. And they looked at a retrospective analysis of, it turned out, 28 patients with serious mental illness, a mixture of bipolar disease, major depression, schizophrenia. And the ketogenic diet improved symptoms in 100% of patients. 100% of patients. 43 achieved clinical remission. 64% were discharged on less medication. So yes, there is some evidence out there for depression. Depression is now thought to be a chronic inflammatory disease. There's a wonderful study by one of my Australian colleagues, Felice Jacker, called the SMILES trial, where she showed very positive results of a dietary intervention in patients with depression. Better results than antidepressant medication. And she's got a great book called The Brain Changer, which I recommend to you. So yes, there is evidence out there, and this is a wonderful summary of the evidence by Nick Norritz, who's the world's most credentialed medical student, and Chris Palmer. And they sum up basically what I've said. In fact, I could have just shown this slide and you wouldn't have bored you for the last 10 minutes, but that summarises the amount of clinical evidence in this area. So why have we got this epidemic of chronic disease? What causes chronic disease? Well, I've come up with 4 factors that, over the last decade or two, have been proposed as the causes or contributing factors to chronic disease. Insulin resistance, inflammation, gut dysbiosis, and mitochondrial dysfunction. We've heard all about insulin resistance today. I think this audience understands that very well. Important role in chronic disease. Then we started to hear about inflammation. You know, as a sports doctor, I know all about inflammation, chronic inflammation, nice big red swollen joint. But no, this is a different type of inflammation, a low-grade chronic inflammation that's been implicated in many chronic diseases. And then everywhere we go, you hear about the gut microbiome and the role of the gut microbiome and dysbiosis in chronic disease. And finally, more recently, we've been hearing about mitochondrial dysfunction. We've been measuring mitochondrial dysfunction and seeing how it relates to chronic disease. So there we have those 4 potential contributing factors, I won't call them causes, to chronic disease. And the interesting thing about them is that they're all interrelated. Every one of them has relationships with all the others. And what's the one thing that these 4 potential causes have in common? Well, they all can be affected by a ketogenic diet, improving insulin sensitivity, anti-inflammatory properties, regulation of gut microbiome, altering mitochondrial function. So here we have chronic disease, the 4 potential causes, and the one thing that seems to work is a low-carb ketogenic diet. So maybe that 93% of the US population that are metabolically unwell, maybe the first line of treatment should be a low-carb ketogenic diet. I suspect the other 7% are already on it. Thank you.